Joining us for a little bit is State Legislator Cedric Glover. Hey, Mr. Cedric, welcome back to KEEL. How you been, man?
Good morning, Erin. Good morning, Robert.
Morning.
Let's start here. Ochsner is now sort of they're operating the hospital, University Health, the med school, etc. What do you think about that? Is it a good deal? Are you long-term, short-term too, optimistic?
Well, guys, you know that over the last 3 years, this is something that I have been advocating for, pushing for, demanding, and have been particularly perturbed that we have missed out on 3 years of this because it was in April of 2015 when the folks at the BRF first brought the folks from Ochsner to the table, but you had local players here, local politicians who blocked that. So great news on yesterday, just 3 days delayed at this point. And I think the focus still needs to be on how it is that we actually manage to take these assets and use them not just to secure the future of the medical school, but to ultimately, as Steve Scavano said on yesterday, position us for the very first time, in my estimation, in 50-plus years, actually use this academic health center as an economic engine to help drive the growth of job and wealth creation in North Louisiana.
What do you think that Ochsner, this is a pretty big move, what do you think Ochsner is going to be able to do to achieve for the med school, for University Health Hospital, that under the aegis of Biomedical Research Foundation, nobody was able to do?
Well, now remember, Biomed was founded to help facilitate the growth, development, expansion of the biotechnical industry in Shreveport and North Louisiana. It's not actually a hospital operator. They stepped in back in 2013, to ensure that we didn't end up either having the hospital end up under Willis-Knighton or to some other outside operator that was not a part of this community. We did not need to expand the local monopoly that existed, and we did not need someone that didn't have an appreciation and respect for Louisiana in general and North Louisiana. But now the thing that really is exciting about this is that you have to remember Ochsner is the only hospital in Louisiana, Arkansas, or Mississippi that's actually listed in the top 100 hospitals across the entire country. They are nationally ranked, considered to be the best that we have to offer here inside the state of Louisiana. The fact that we now have an opportunity to be able to push back against that current monopoly and bring in the best operator within a 3-state region and partner with our medical school gives us a chance to be able to finally have an opportunity and a potential to be able to put our assets here on a path similar to those of UAB, University of Alabama at Birmingham, that's over in Alabama, Johns Hopkins up in Maryland, the Texas Health Center over in Houston, and other similar types of efforts across the country, where you don't just have a medical school, you don't just have a teaching hospital, you actually have an economic engine that helps to lead, drive, and grow your region.
Cedric, we're talking to Cedric Glover, State Rep. Can we reverse the trend of the brain drain? We've lost so many greats. Can we turn that around? Can we attract some even brighter?
Well, a big part of that is going to be dependent upon what happens on the LSU side of the equation. One of the unfortunate realities is that we have filled the top leadership positions at the institution without any basis of an actual real search process. We've put in folks who are close to folks at Willis-Knighton. We've put in folks who have been a part of keeping us on this 3-year delay to get to Ochsner. What we haven't done is sought the best and the brightest. And because we haven't done that, we've ultimately run off people like Anil Nanda, who represented world-class intellectual capital for Shreveport and North Louisiana. We punished him by sending him back to his wife's hometown and putting him in charge of not one department of neurology, but 2 department of neurology at 2 ranked medical schools when he was leaving one that was unranked. Those are the types of things that have got to change if we want Shreveport and North Louisiana to change.
You have been very skeptical and have been vocal about South Louisiana wants our med school, Baton Rouge in particular. Does this ease that concern of yours at all?
Well, again, as I said earlier, this isn't about just safeguarding the medical school. We've effectively done that. That still doesn't belie the fact that Baton Rouge wants it to have one as well. But now what we've also got to do is to make sure that we don't just simply maintain the status quo. Understand, we have been blessed for over half a century to have one of 140 academic health centers in the United States of America. What it has not done is serve as a catalyst for the growth, development, and expansion of this regional economy. in a way that allows us to be able to stop that brain drain, keep those who are here at home, and to attract others from other places. That's what we got to focus on. This was never about just simply saving the medical school. Obviously, that's something that needed to happen because of the intention of the folks in Baton Rouge, their articulated plan to develop a Baton Rouge health district for their area. We have a health district here that folks don't recognize, don't acknowledge, and don't understand it. It's on Kings Highway. We've got some substantial assets there. Public investments have been made. We've just never, ever brought it together completely and given it the level of funding and resources necessary to allow it to be exactly what it is that it has potential to be. The most telling aspect of this whole situation is this, and you've heard me get on my soapbox and talk about the disrespect in terms of funding for North Louisiana and this hospital in particular. The one thing that affirms that we've been right in that contention all along is that BRF was given $251 million to run safety net and teaching hospitals in Shreveport and Monroe. Come October 1st, in the same fiscal year, Ochsner will be given $43 million more, or $294 million, to do the same thing that we challenged our local folks to do. While they did that, we had local folks and LSU people who did nothing but harp on their ability to be able to effectively address their funding needs and their cash flow needs, and yet we were already knowingly underfunding them by over $40 million. And the folks from Ochsner show up, and we give them $43 million in the blink of an eye. That represents the kind of actions, thinkings, and behavior that continues to hold Shreveport and North Louisiana behind.
You know, you had mentioned a couple of times in our conversation the brain drain. So I guess the first question would be, is it fair to say there's been a morale problem at University Health and the med school? And if there has been, do you think this morning the doctors, the nurses, everybody, do you think they're jumping up and down, clapping their hands?
Well, there's been a morale problem since 2013 when Governor Jindal made the decision to privatize this operation and did so in very short order. He had the closure of Earl K. Long down in Baton Rouge, the closure of the facility in Alexandria, folks who were losing retirements and benefits and positions. And I mean, it was a process that should have been done with a scalpel. It was done with a hatchet. And so despite that, those folks here, especially in Shreveport and Monroe, stepped up to the plate, partnered with the folks at BRF, and actually took a situation that was very much of a challenge and actually made it better. They improved wait times. They improved the quality of care. They made it where you had a universal level playing field for all patients when it came to the quality of the care that they were provided. And they actually ended up making it possible for this particular partnership for Ochsner to take place because they showed that they could effectively perform. What they now realize, I think, after conversations yesterday with employee groups both here in Shreveport and Monroe, that they're stepping into what is now even a better situation because Ochsner is a world-class institution. They have been in the business of providing high-quality health care for a very long time, and folks now who are in the healthcare profession have an opportunity to be able to work for an organization that gives them an opportunity to not just have a great job, but also have a path to a great career as well.